trying to keep up with Social Security and Medicare, it feels like a constant puzzle, doesn't it?
Oh,
Especially with new rules seeming to pop up each year.
it really does. Things are always shifting.
So let's unpack this. This deep dive is all about the key shifts, the really important changes in Social Security and Medicare that you need to know for 2025.
Mm-hmm.
We've, gone through a bunch of reports and articles to pull out what truly matters. The goal is to give you the insights without the overwhelm.
Yeah, and what's fascinating as we look at these 2025 updates is how they kind of reflect these broader pressures on the whole system.
How so?
Well, you see this push and pull between, managing costs, trying to ensure access, and adapting to how needs are evolving. And
Right.
it really highlights the dynamic nature of these programs that just so many people depend on.
Okay, so let's get straight into Medicare for 2025 then. The bottom line, according to the Motley Fool anyway, is that premiums and deductibles, they're going up across the board.
Yeah, that's generally the direction. Not exactly the news anyone wants to hear, right?
Right. Definitely not. But it's something you absolutely need to factor into your planning for next year.
Exactly. And these rising costs, they're really a reflection of the continuous increase in healthcare spending overall. Even a huge system like Medicare feels that pressure.
So for you, the listener, this means really taking a close look at your budget, understanding that potential impact on your out-of-pocket expenses.
Precisely.
Now, here's maybe some better news. A significant development on the prescription drug front.
Yes, the cap.
Both the Motley Fool and AARP are highlighting this $2,000 annual cap on what you'll pay out of pocket for your medications. This could be a real game changer for many people.
Absolutely. AARP estimates this cap will bring savings to around, I think it was 3.2 million people on Medicare drug plans.
Wow, 3.2 million.
Yeah. So if you're managing ongoing health conditions with, costly prescriptions, this change could offer substantial financial relief, really significant.
And to help manage those costs,
Mm.
throughout the year, AARP also mentions the Medicare prescription payment plan.
Mm-hmm. The smoothing mechanism.
Right. It lets you pay your prescription expenses in monthly installments instead of maybe a huge chunk all at once.
Which can happen especially early in the year.
Yeah. And apparently, you can enroll in this anytime just by reaching out to your Part D provider. So it's about making those costs more manageable month to month.
That payment plan is a really practical tool. It doesn't change the total you pay over the year, let's be clear.
Right. Still capped at $2 K eventually.
But it can significantly ease the burden on your monthly cash flow. Like I said, particularly in those early months when deductibles often come into play before the plan starts paying more.
Okay, good point. Now, it's important to keep in mind something Tricia Newman from KFF raised, which AARP reported on.
What's that?
This $2,000 cap, it doesn't include your monthly premiums.
Ah, yes. Crucial distinction. The cap is on your drug costs, not the cost of having the plan itself.
Exactly. So while your out-of-pocket for the drugs is limited, you still need to budget for those regular premium payments. And AARP also notes that these Part D plans in 2025, they can still have a deductible of up to $590 before your copays even kick in.
So it's a multi-stage system you need to understand. You pay the premium just to be in the plan.
Okay.
Then you might pay up to that $590 deductible out of pocket first. Then you start paying copays or coinsurance for your drugs, and those costs count towards the $2,000 cap.
Got it. It's layered. Premiums, deductible, copays, then the cap. Understanding each piece is key to anticipating your total costs.
You've got it.
Okay, let's switch gears a bit. Telehealth. The Motley Fool points out that access is actually becoming more restricted in 2025.
Yeah, that's a shift back from the really broad availability we saw, especially during, the height of the pandemic in 2024.
So what's the new rule, generally?
Generally, for most telehealth services in 2025, you'll now need to be physically present in like a doctor's office or another medical facility that's located in a rural area.
Okay. Why the change, do you think?
Well, it likely reflects a kind of reevaluation of those flexibilities that were put in place during the public health emergency, maybe focusing more on cost control or ensuring appropriate care settings now things are more stable.
Which could definitely impact people who got used to the convenience of accessing care right from home.
For sure.
But there are some key exceptions, aren't there? The Motley Fool mentioned things like monthly dialysis visits at home,
Right. ESRD visits.
care for acute stroke symptoms, and importantly, behavioral health services.
Yes, those exceptions are critical. And the permanent expansion of telemedicine for behavioral health, which AARP also highlights as a real positive.
That seems huge.
It is. It's really significant. It can break down so many barriers to getting mental health care, especially if you live in a rural or underserved area.
That makes sense.
And AARP also notes that some other telehealth provisions, the ones expanded during the pandemic, have been temporarily extended because of a recent congressional budget bill.
Okay, so it's not a complete rollback on everything.
Not entirely. While the general trend is a tightening of access, certain vital areas like behavioral health are being maintained or even permanently expanded. So some good news mixed in there.
Definitely good news regarding mental health access. Now, AARP also detailed a pretty big expansion of something called the GUIDE program. Supports family caregivers for dementia patients.
Yes, GUIDE. That sounds like a really valuable resource.
It is. The program is set to basically quadruple its reach in 2025.
Quadruple. Wow, what does it offer?
It offers quite a bit. A 24/7 support line, a dedicated care navigator to help families sort things out,
That sounds helpful.
caregiver training, and importantly, up to $2,500 per year for respite care services, so caregivers can get a break.
Oh, respite care. That's essential.
Absolutely. And critically, AARP indicates that there are typically no co-payments for the patients and caregivers using this program.
That's great.
It really recognizes the immense, often overwhelming demands placed on people caring for loved ones with dementia. And the number of organizations participating is jumping too, right? AARP said from 96 to 294 in July 2025.
Yeah, a huge increase. That means many more families across the country will potentially have access to this vital support. It can make a real difference in their ability to provide care and, just as importantly, maintain their own well-being.
Okay, really positive development there. Let's move on to something that might be influencing some of these changes, perhaps behind the scenes. We saw a fact sheet highlighting considerable lobbying efforts by the major Medicare Advantage companies.
The MA lobby. Yes, that's always a factor to consider.
It feels like an important piece of the puzzle. The fact sheet says just 7 companies account for, get this, 84% of all Medicare Advantage enrollment.
Wow, that's concentrated. 7 companies, 84%.
Yeah, and these 7 companies collectively spent over $330 million in the last 5 years lobbying on all sorts of issues.
$330 million. That's a lot of influence potentially being bought.
It certainly suggests that the landscape of Medicare Advantage is, let's say, heavily influenced by these big players. So for you, the listener, when you're choosing an MA plan, just remember, these companies have a vested interest in certain structures and regulations.
Which may or may not always align perfectly with your individual healthcare needs or what's best for the overall Medicare system, right?
Exactly. And in 2024 alone, these same 7 companies deployed 328 lobbyists in total,
328.
with 223 of those specifically focused on lobbying about Medicare Advantage.
Okay, so a huge chunk of their lobbying muscle is aimed directly at MA policy.
Yeah, the fact sheet noted that at least half of all lobbyists hired by each of these companies in 2024 lobbied specifically on Medicare Advantage.
It really underscores how much is at stake for these companies financially in terms of MA policy and especially payment rates. Their lobbying aims to shape the rules in ways that benefit their business models.
Okay, something to be aware of. Now, Charles Schwab raises an important point about how higher income can impact your Medicare premiums. IRMAA surcharges.
Yes, IRMAA, the income-related monthly adjustment amount. This can definitely catch some retirees off guard if they're not expecting it.
How does it work again, basically?
Basically, if your modified adjusted gross income from 2 years prior exceeds certain thresholds, you'll pay a higher premium for your Medicare Part B, the medical insurance part, and also for your Part D prescription drug plan.
2 years prior, so like 2023 income affects 2025 premiums.
That's right. The government looks back 2 years. So big income fluctuations in your immediate pre-retirement years, maybe from selling a business or large capital gains, can trigger these surcharges later on.
But Schwab also notes you can request a reevaluation, right? If there was an error or if you had a significant life-changing event.
Correct. Things like stopping work, divorce, death of a spouse, experiencing a serious disease, even fraud. These are listed as potential qualifying events on the official form, which is Form SSA 44.
Okay, SSA 44. Good to know. So it's worth looking into if your income situation has changed dramatically since that 2-year look-back period.
Absolutely. And as Schwab points out, even if your initial request using that form is denied, you do have appeal rights.
And for people still planning, Schwab suggests some strategies to maybe manage income to reduce potential IRMAA hits, like Roth conversions or timing a home sale carefully.
Yes, There are financial planning strategies, things like spreading out income, using Roth accounts where qualified distributions are tax-free, timing asset sales.
But they do advise consulting a financial advisor.
Definitely. It gets complex, and personalized advice is really key for managing IRMAA effectively. Proactive planning in the years leading up to and during retirement can make a difference.
Got it. Okay, last point on the Medicare side for now. Healthcare Dive reports that the Trump administration finalized higher payment rates for Medicare Advantage plans for 2026.
Looking ahead slightly.
Yeah, it's for the year after our main focus, but it probably gives us a sense of the direction things are heading.
It likely does. What did they report?
A 5.1% benchmark increase. Healthcare Dive says this is pretty significant and expected to help MA plans boost their financial margins. Accelerate margin recovery was the phrase.
Okay, 5.1%. That's a healthy bump for the plans.
It also mentioned that changes to how plans code patient diagnoses. You know, the whole issue around making members seem sicker to get higher payments.
Risk adjustment coding, yeah. A controversial area.
Right. Those changes aimed at preventing that are being fully phased in, despite pushback from the MA industry.
Interesting. So higher base payments, but also tighter rules on the risk coding, potentially. A bit of give and take there from the administration's perspective.
Seems like it. And Healthcare Dive also just threw out the number that Medicare Advantage is projected to cost taxpayers nearly $600 billion overall in 2025.
$600 billion, that's a staggering figure. Really underscores the massive financial footprint of MA within the broader Medicare system.
Definitely. Raises those ongoing questions about long-term costs and the value proposition, like you said earlier.
Indeed. A lot to watch there.
Okay, let's pivot now. Let's turn our attention to Social Security changes coming up in 2025.
Right.
The big one everyone always waits for, the cost of living adjustment. The KLA, what's the number?
Okay, the official word from the SSA COLA fact sheet, and confirmed by others like Carr, Riggs, and Ingram, is 2.5% for 2025. That applies to both Social Security retirement and disability benefits, and also SSI payments.
2.5%. How does that translate in terms of dollars, roughly?
Carr, Riggs, and Ingram did the math. They estimate the average retiree can expect about $50 more per month in their benefit, starting in January 2025.
$50 more. Okay.
And that 2.5% COLA, it's based on the inflation measure they use, the CPIW, specifically the increase from the third quarter of 2023 to the third quarter of 2024.
Right. And Carr, Riggs, and Ingram also pointed out, interestingly, that while 2.5% is obviously an increase, it's actually a little lower than the average CLA over the past decade.
Oh, really? What was the average?
2.6%. So slightly below the recent historical average, just a bit of context.
Good context. Still, an increase is an increase.
True. Now, what about the taxes for people still working? Social Security and Medicare taxes, any changes to the rates in 2025?
Nope. The rates themselves are holding steady. The SSA COLA fact sheet confirms this. For employees, it remains 7.65%. For self-employed folks, it's double that, 15.30%.
And that 7.65% breaks down how?
It's 6.2% for Social Security. That's the OASDI part, but that only applies up to a certain income limit, which we'll get to. And then 1.45% for Medicare, the HI part, and that applies to all earnings. No income limit on the Medicare tax.
Right. Plus, we shouldn't forget that extra 0.9% Medicare tax for higher earners.
Correct. The additional Medicare tax. That kicks in for individuals earning over $200,000 or married couples filing jointly earning over $250,000. The SSA fact sheet reminds us of that, too.
Okay, so rates are the same,
right.
But you mentioned the income limit for the Social Security part of the tax. That is changing, right?
Yes, it is. The maximum amount of earnings subject to the Social Security tax goes up almost every year based on wage growth. For 2025, the SSA fact sheet says it increases from $168,600 in 2024 up to $174,900.
So $174,900. That means higher income earners will pay Social Security tax on a slightly larger chunk of their earnings next year.
Exactly. More income gets taxed for Social Security, which means slightly more revenue for the system from those earners.
Okay. Now, what about people who are receiving Social Security benefits but are still working and they haven't hit their full retirement age yet? There are limits on what they can earn, and those limits are changing too.
Yes, the earnings test limits are also adjusted annually based on wage growth. The SSA COLA fact sheet and their Understanding Benefits publication lay out the 2025 numbers.
So what's the main limit for someone under full retirement age for all of 2025?
For 2025, if you're collecting benefits and you're under your full retirement age for the entire year, the earnings limit is $23,400.
Okay, up from $22,320. And what happens if you earn more than that?
If your earnings go over that $23,400 limit, Social Security will withhold $1 in benefits for every $2 you earn above the limit.
$1 withheld for every $2 over.
Got it. But the rules are a bit different and actually more generous in the specific year you reach your full retirement age, right?
That's correct. In the calendar year you hit full retirement age, the earnings limit is much higher. For 2025, it's $62,160.
$62,000, okay. Up from about $59,500.
Right. And the withholding rate is also less severe. In that year, they only withhold $1 in benefits for every $3 you earn above the $62,160 limit.
1 for 3. Okay.
And crucially, this only applies to earnings before the month you actually reach your full retirement age.
So once that birthday month hits.
Once you reach full retirement age, boom, no limit. You can earn as much as you want, and your benefits will not be reduced based on earnings from that point forward.
That's a really important milestone for people to understand if they plan to work past their FRA.
Definitely. Okay, the SSA COLA fact sheet also updated the numbers related to disability benefits, substantial gainful activity, SGA, and the trial work period, TWP.
Yes, these thresholds also increase based on wage changes. For 2025, the SGA amount for non-blind individuals will be $1,620 per month, up from $1,550.
Right. For blind individuals, the SGA threshold is higher. It'll be $2,700 per month.
Up from $2,590.
And the trial work period amount, that's the level of earnings that triggers a trial work month for disability beneficiaries. That will be $1,160 per month in 2025.
Okay, up from $11,110. So adjustments across the board reflecting wage growth.
Pretty much standard annual adjustments there.
And for people just starting to take benefits, is there an increase in the maximum possible Social Security benefit someone could receive if they retire at their full retirement age?
Yes, that maximum benefit also typically increases each year. The SSA CLA fact sheet shows that for someone retiring at their full retirement age in 2025, the maximum monthly benefit will be $4,018.
$4,018 a month. That's up from $3,822 in 2024.
It is. But it's really important to stress, very few workers actually qualify for that absolute maximum amount. You need to have earned the taxable maximum or close to it for basically your entire working career.
Right. It's the ceiling, not the typical benefit by any means.
Exactly. Kiplinger flagged something interesting too, that in 2025, it will take slightly higher earnings to earn a Social Security work credit. Remind us how those credits work.
Sure. To qualify for Social Security retirement benefits, you generally need 40 work credits over your lifetime. You can earn up to 4 credits per year.
Okay.
The amount of earnings needed for 1 credit goes up a bit each year based on average wages. Kiplinger is just noting that trend continues for 2025. You'll need to earn slightly more than you did in 2024 to get credited for those quarters of work.
Gotcha. So still need 40 credits total, max 4 per year, but the dollar amount per credit creeps up.
Precisely.
Now, here's some potentially very big news for a specific group of retirees. FOX9 reported on this. Millions of retired public sector workers, teachers, firefighters, police officers, folks like that.
The ones affected by WEP and GPO.
Exactly. They're set to see a boost in their Social Security benefits because of the repeal of the windfall elimination provision, WEP, and the government pension offset, GPO. This was part of the Social Security Fairness Act that became law earlier this year.
Wow, okay. That's huge news for those retirees. WEP and GPO have been incredibly controversial for decades, significantly reducing Social Security benefits for people who also had public pensions.
It sounds like a really positive change for them. How will it work?
Well, the repeal means their Social Security benefits will now be calculated more like everyone else's without those specific reductions. FOX9 indicated that affected retirees should receive a one-time retroactive payment by the end of March next year.
Retroactive, okay.
With their ongoing monthly payments increasing starting in April 2025. This could be a really significant financial boost for potentially millions of people.
That is certainly welcome news for those who've been waiting for this for a long time. Now, shifting gears to a different administrative and policy area, Benefits Insider mentioned an executive order signed by President Trump.
Okay, what was the focus?
It was focused on preventing undocumented immigrants from receiving Social Security benefits, presented as, protecting the program's integrity.
Right. This reflects an ongoing policy focus on ensuring benefits are paid only to those who meet all the legal requirements, including lawful presence and work authorization. The specific impact would depend on how it's implemented through agency rules and enforcement.
Okay. We also came across some, frankly, concerning reports from places like the Brookings Institution and the Medicare Rights Center about the Trump administration's Department of Government Efficiency, DOGE.
Ah, yes, DOGE. Their involvement with the Social Security Administration did raise some alarms in certain circles.
Yeah, these reports highlighted concerns about potentially significant workforce cuts, field office closures, and general reductions in service capacity at SSA, all initiated by this DOGE team.
There was a lot of discussion about the potential impact on beneficiaries being able to access services.
And there were also reports, kind of worrying ones, about DOG staff getting access to the Master Social Security Number database. That understandably raised some serious concerns about data security and privacy.
Definitely. Access to the Numident file, that master database, is extremely sensitive. Any expansion of access warrants very close scrutiny.
The Medicare Rights Center actually listed specific SSA field offices that were apparently targeted for closure. Closing physical offices could certainly make it harder for people, especially maybe older folks or those less tech-savvy, to get in-person help.
That's the core concern raised, that reducing physical access points could create barriers and delays for people needing help with claims or other issues.
And Brookings quoted the acting commissioner at the time, Lee Dudek, expressing concern that these rapid changes initiated by DOGE could potentially break things.
Which is not a phrase you want to hear associated with the administration of Social Security. It suggests the pace and scale of changes were causing internal anxiety about operational stability.
Indeed. The analyses we saw definitely flagged the potential negative impacts on the SSA's ability to deliver services effectively.
Right. Reduced access, potential delays, difficulties for people trying to navigate the system, those were the main worries highlighted.
However, to present the other side, we also saw a press release from the SSA itself, dated March 19th. It outlined their own efforts to achieve cost savings and improve efficiency.
Okay, so the agency's perspective on these changes.
Yeah. They mentioned things like terminating certain contracts, refocusing the workforce on direct customer service, which included requiring a return to in-person work for many employees, and generally streamlining internal bureaucracy.
And they put a number on the savings.
They did. They estimated these measures could save over $1 billion. So, there's clearly a stated rationale from the agency focused on optimization and cost reduction.
Right. Their narrative is about eliminating waste, improving resource allocation, and ultimately enhancing the customer experience, even if some of the methods, like the return to office mandate or potential office consolidations, are controversial.
And a big part of that efficiency drive, according to another SSA press release also from March 19th, involves boosting efforts to combat identity fraud.
Fraud prevention. Always a high priority.
They're planning to enhance their electronic verification service, the ECBSV system, and implement stricter identity verification procedures overall,
How so?
including requiring in-person identity proofing for people who need to do certain things online but maybe can't use their My Social Security account for some reason. That starts April 14th, 2025.
Okay, in-person proofing for some online transactions, that's a significant security step. It's likely a response to ongoing concerns and maybe audit findings about the security of online transactions.
But they did note some exceptions to that in-person requirement, didn't they?
Yes, the press release mentioned that initial applications for Medicare, disability, and SSI benefits would be exempt from that specific in-person proofing rule.
Okay, so trying not to create barriers for initial access to critical benefits.
Seems to be the goal there, yes. Protecting vulnerable populations during the application stage.
Another fraud prevention measure. From an SSA press release dated March 12th. They're eliminating the option to change your direct deposit information over the phone.
Oh, interesting. So how do you change it now?
You'll have to either do it online using their two-factor authentication process or physically go into an SSA office.
Oh, okay. That definitely closes a potential avenue for fraudsters trying to reroute payments via phone scams. It might be less convenient for some beneficiaries, but you can see the security rationale.
Yeah, it seems pretty clear. Now, regarding overpayments, when SSA pays someone too much by mistake.
Which does happen, unfortunately.
An SSA press release from March 7th announced they're increasing the default rate at which they recover those overpayments.
Yeah.
back up to 100% of a person's monthly benefit in many cases.
Wow, 100% withholding, that's aggressive. It used to be much lower, often 10%, unless there were specific circumstances.
Right. They estimate this more aggressive recovery rate will increase the amount they get back by about $7 billion over the next decade.
7 billion is a lot, but withholding someone's entire check, even for a month or two, that could create extreme hardship for people living check to check.
Absolutely. It's a significant policy shift aimed at recouping funds faster. But the potential impact on individuals facing that recovery could be severe.
Definitely something people need to be aware of if they get an overpayment notice.
We also saw a quick mention in a March 5th press release about the agency making progress cleaning up records, specifically identifying and correcting records for beneficiaries aged 100 or older who don't have a recorded date of death on file.
Ah, the Centenarian Project, yeah. That's important administrative work to maintain accurate records and prevent improper payments from continuing after someone has passed away.
Makes sense. And finally, on the administrative front, another March 5th release briefly mentioned a voluntary separation incentive program, VSA, or buyouts being offered to SSA employees for a limited time until April 19th, 2025.
Okay, so offering incentives for employees to leave voluntarily. That often goes hand in hand with broader efforts to reshape or reduce the workforce, aligning with those efficiency goals we talked about.
Seems plausible. Okay, let's step back now and look at the bigger picture, the long-term financial health of Social Security and Medicare. The 2024 Trustees Report came out, and the projections, well, they require attention.
That's putting it mildly. The trustees' reports always provide that sobering, long-range forecast. What are the latest projections?
For Social Security, the main trust fund for retirement and survivor benefits, the OESI fund, is projected to run short around 2033.
2033. Still roughly the same time frame as recent reports, and what happens then?
At that point, the report says incoming payroll taxes would only be enough to pay about 3/4, maybe 77%, 79%, depending on the exact calculation of scheduled benefits. So not zero, but a significant shortfall if nothing changes.
Right. Depletion doesn't mean benefits stop entirely, but it means automatic, across-the-board cuts would happen unless Congress acts. What about the disability fund?
The DI fund is actually projected to remain solvent throughout the long-range 75-year projection period. So the immediate pressure is really on the retirement side of Social Security.
Okay. And Medicare. What's the projection for its main hospital insurance trust fund, Part A?
The HI trust fund is projected to be depleted a bit later, in 2036.
2036. Also a looming deadline. And similar implications, right? Incoming revenue wouldn't cover all expected hospital costs after that point without changes.
Exactly. And the trustees themselves, in the report, strongly urge lawmakers to address these projected shortfalls in a timely manner.
The sooner the better, essentially, because the longer they wait, the larger and more difficult the necessary adjustments become.
And we know there are various proposals floating around to change Social Security, as the SSA website itself outlines. You see different ideas constantly.
A whole spectrum of options, yeah.
One recent specific example mentioned was the You Earn It, You Keep It Act, introduced just on April 14th, 2025. So the debate about solvency and potential reforms is very much alive.
These proposals touch everything, right? Adjusting benefit formulas, maybe changing the full retirement age again, increasing payroll taxes, lifting the income cap on Social Security taxes.
All those levers.
The You Earned It, You Keep It Act is likely one specific package focusing on certain approaches, but it's part of that much broader ongoing discussion.
One specific type of reform often discussed is means testing for Social Security. The American Academy of Actuaries looked at this. What's the basic idea?
Means testing in this context generally means reducing Social Security benefits for individuals who have higher incomes or significant wealth in retirement.
And what are the arguments for and against it?
Well, proponents argue it could significantly reduce the program's overall cost and make it more progressive, targeting benefits more towards those with lower or moderate lifetime earnings.
Okay, the cost-saving argument.
Right. But the Academy of Actuaries also points out major potential downsides. One big one is the risk of eroding broad public support for Social Security if it starts looking less like a universal earned benefit and more like a welfare program only for the less well-off.
The social insurance versus welfare debate.
Exactly. There are also concerns it could create disincentives for people to save during their working years, if they know having more savings will just lead to lower Social Security benefits later. Plus, administering a means test could be complex and costly.
Definitely highlights the tricky trade-offs involved when you consider changing such a fundamental program. Now, shifting focus slightly, the Center for Retirement Research had an interesting finding about who benefits most from Medicare and Medicaid.
Oh. Who did they find gets the most net benefit?
Middle-class retirees. When you compare the taxes they paid in versus the value of the benefits they receive over their retirement, the middle-income group comes out ahead compared to lower or higher-income groups.
That's fascinating. It really underscores just how critical these programs are for providing healthcare security specifically for that middle income bracket throughout their retirement years.
Yeah, it suggests changes to these programs could disproportionately impact the financial stability of the middle class in retirement.
A very important consideration in policy debates.
We also briefly touched on the idea of raising the Medicare eligibility age earlier. One of our sources outlined some potential negative consequences.
Right, raising it from 65 to, say, 67 or higher. What were the main concerns flagged?
Concerns about the impact on older workers, especially those in physically demanding jobs who might not be able to work longer, or those with pre-existing health conditions who could lose coverage.
Leaving them in a coverage gap before Medicare kicks in.
Exactly. And also the possibility that it wouldn't actually save the overall healthcare system much money, but might just shift costs onto individuals, families, and employers who would have to find or pay for private insurance during those gap years.
Yeah, the cost-shifting argument is a major one. It could lead to higher premiums in the private market, too, if older, potentially less healthy people are added to those insurance pools.
A most analysis document we looked at had a pretty stark warning, delaying any reforms to Social Security and Medicare. It just makes the inevitable changes harder.
That's the core message from almost every analysis, isn't it? The math doesn't get better by waiting.
It suggests that waiting too long could force much more drastic benefit reductions or significantly larger tax increases down the road, compared to making smaller, more gradual adjustments sooner.
It's the classic pay me now or pay me later scenario, but the later payment is almost always bigger and more disruptive. It gives people and the economy less time to adjust.
Right. Finally, we glanced at a SWOT analysis: strengths, weaknesses, opportunities, threats related to potential changes in Social Security and Medicare.
Ah, the SWOT framework. Always a useful way to summarize complex situations.
It highlighted potential strengths like, increased public support if changes lead to a system seen as more sustainable or modern, and opportunities like adapting the programs better to changing demographics or leveraging economic growth.
Okay, the potential upsides.
But it also noted the obvious weaknesses like political resistance to any benefit cuts or tax increases, and just the sheer complexity of these huge programs.
And the threat?
The ongoing threat of funding shortfalls if nothing is done, and maybe external economic shocks that could worsen the financial picture. It's just a good reminder of all the different angles and pressures involved.
Absolutely. It underscores that any significant change involves balancing competing priorities and navigating a really complex set of interconnected consequences. There are no easy answers.
For sure. So as we wrap up this deep dive into the Social Security and Medicare changes for 2025, some key themes definitely stand out.
Yeah. What are your main takeaways?
Well, on Medicare side, it's this mix. Rising costs, yes, but also that potentially huge relief from the new cap on out-of-pocket prescription expenses.
Mm-hmm.
Then you've got telehealth access getting tighter for many, but importantly expanding for behavioral health and caregivers getting more support through the GUIDE program.
And don't forget the behind-the-scenes stuff, the influence of those major Medicare Advantage firms, and all the ongoing administrative shifts and efficiency drives within the agency itself.
Right, and on the Social Security front.
You have the modest COLA, the adjustments to earnings limits and disability thresholds, the usual annual stuff. But also that really significant news about the WEP and GPO repeal finally happening for public retirees.
That's a big one.
Plus, all those administrative changes at SSA aiming for efficiency and fraud reduction, which sound good on paper, but also raise those questions about service accessibility and potential impacts on beneficiaries.
And looming over everything are those long-term financial challenges for both programs, fueling the continuous and often contentious debates about potential reforms.
Exactly. Solvency is the elephant in the room that never leaves.
It's really clear that staying informed about all these evolving pieces is just essential for anyone planning for or living in retirement.
Couldn't agree more. These programs are just too important.
So here's maybe a final thought for you, our listener. Considering everything we've discussed today, all these changes, the ongoing debates about the future of Social Security and Medicare, what stands out to you as the most significant development, or perhaps the biggest uncertainty moving forward?
Yeah, what worries you most or what gives you hope?
And how might these updates influence your own retirement planning, or even just your perspective on this broader societal conversation about these absolutely crucial programs. Definitely something to consider.